Hello, dear all. So, in this discussion, we will have to understand the concept of susceptibility discussed by Dr. Herbert Roberts. So, with a reference to aphorism number 31, described in Organon of Medicine by Dr. Hahnemann about the morbific noxious agent. So, this is the inimical forces which are psychical, so maybe mental trauma, partly physical. So, the causes may be, say, physical, that is, say, trauma or getting injured or having the weak, in today's terminology, infection to which our terrestrial existence is exposed, which are termed morbific noxious agent, do not possess the power of morbidly deranging the health of man unconditionally. But we are made ill by them only when our organism is sufficiently disposed and susceptible to the attack of the morbific cause that may be present, and to be altered in its health, deranged, and made to undergo abnormal sensations and functions. Hence, they do not produce disease in everyone, nor at all times. We all of us know that suppose we are sitting in students are there in a classroom, and we observe that one of the students suffers from the infection of TB, so but others do not suffer. So this is the example that the diseases are conditional. So even though there are the tubercular bacilli in the droplets in the air, but only one student is getting affected in a classroom, this means he is affected because he is susceptible to that infection, and others have resistance against the infection. Before knowing the views of Dr. H.A. Roberts on susceptibility, many stalwarts has given their significant contribution on understanding susceptibility. Dr. James Tyler Kent describes it as influx. Stuart Close says it is a power to react to stimuli. Word meaning of susceptibility. So first divide the word in susceptus, means to take, admit, likely or liable to be influenced. Definition according to H.A. Roberts is susceptibility is defined as reaction to external and internal influences or stimuli. Example of mimosa plant. Before stimulus, the leaves are expanded, they are appearing fresh, and after the touch, they are leaves get converged, and they because of the stimulus of touch, they get folded. Susceptibility is increased, decreased, or destroyed. So susceptibility, if it is increased or decreased, it leads to the diseases in individuals. And it is destroyed, that is observed in the dead person. There is no reaction to the stimuli. Dr. H.A. Roberts say that susceptibility can be seen in animal, plant kingdom as well as in human beings. We just now saw the examples of the plant kingdom. Now let's see about the animal kingdom. He is a Bengal tiger, and he is seen in the jungles of the West Bengal, and this polar bear is seen in the Antarctic region. The Bengal tiger cannot survive in the Antarctic, and polar bear in the tropical areas of West Bengal. The plant kingdom also, see the seaweeds, they will survive under the sea, and the cactus survives in the desert and not vice versa. Thus, human beings also, that the group of individuals climbing the mountain, some will have nausea, vomiting, some dizziness, some will have rapid pulse or shortness of breath or insomnia. That is altitude sickness, and this is decompression sickness observed in the scuba divers. Dr. Robert's views is that he calls susceptibility as an expression of vacuum in the individual. So vacuum attracts these morbific noxious agents and makes the person susceptible to diseases. Susceptibility varies in degree in different patients and at different times in the same plane. Homeopathic application of remedy is an illustration to meet susceptibility and filling the vacuum that is present in sick individual. Patient may be susceptible to number of remedies, but the greatest susceptibility is manifested in the most similar, in other words, similimum. So diseases, the deceased individual is having the maximum susceptibility towards the similimum. The application of homeopathic remedy in sickness satisfies the natural susceptibility, no matter how little reaction of the developed in the proving on healthy individual. It means that the remedy is curative to the sick person, even though during the experiment of drug proving, this drug will have little reaction on the prover, but it will be always curative if the symptoms are matched in the sick individual. The indications for a remedy show the susceptibility in marked degree, and the patient will respond because the similar potentized remedy is always stronger than the susceptibility. We already saw that the patient has maximum susceptibility to the similimum. But when we are administering this similimum, we are giving in the higher strength than the patient's diseased symptoms, and thus it will act curative and take away all the disease symptoms of the patient. The susceptibility is expressed as a power of assimilation, digestion, nutrition, healing, repair, secretions, excretion, metabolism, catabolism, disease process. All these depend upon the power of organism to react to specific stimuli. The power of reaction to the stimuli is present in all the living beings. We already saw the examples of plant kingdom, animal kingdom, and in human beings, they suffer from diseases. What is susceptibility? It's nothing but it is food is necessary to satisfy hunger, water is necessary to satisfy thirst, and similimum is necessary to cure the diseases. Thank you.